Let's talk about some topical pain remedies. So earlier we talked about cayenne and the various capsicums or chili peppers as pain remedies taken internally. The great benefit of taking cayenne and chilies internally is that you can saturate the entire body with that capsaicin that suppresses the substance P. So it gets to all the cells. It's a great remedy for things like arthritis where you're looking to cover large areas. We can also use cayenne and other chilies topically, and the way that's usually done is to use a cayenne ointment that contains capsaicin. Usually it's concentrated and standardized for a certain amount of capsaicin. A real typical concentration of capsaicin would be 0.025% capsaicin in an ointment. That's applied externally directly at the area of the pain. It penetrates the tissue, reaches the nerves, and suppresses the transmission of the nerve signal by blocking the substance P. This is a wonderful treatment for pain where you don't need to treat the entire body. You have a spot treatment. So let's say a person has particular difficulty with arthritis in their hands and you want to treat only their hands with a pain remedy. We can use a topical that's going to cover only their hands as opposed to taking a drug or even an herb that we have to take in sufficient quantity to saturate the whole body to get to the hands. So the cayenne ointment is applied. We usually recommend a piece about the size of a pea per major joint or per application. So one pea size amount of ointment per hand, and apply that directly, rub it in completely. And it takes quite some time for that to penetrate. Sometimes people don't get substantial pain relief even for a couple of weeks. Usually within a few days we're starting to see some nice relief, but it saturates the tissues, goes deep into the nerve, and lasts for a substantial amount of time. So once you get the area saturated, the knee, the ankle, the wrist, the sore shoulder, the spot treatment, the person can then skip a few days with no problem. So one pea-sized piece of the ointment per application, per site, per joint, and normally that would be applied twice a day. Now, that's not being applied to be a counter-irritant, to be warming. It may feel warming, it may not. Usually it doesn't, even though it's got that powerful capsaicin in it. Be aware, though, that once you've applied that, be very, very careful with the fingers that you applied it with. You might want to wear gloves when you apply it, but at the very least, wash your hands very well, or cut the ointment with alcohol or something that will dissolve the ointment from the hands, because you don't want that powerful concentrated cayenne ointment going in your eye or some other place that would be uncomfortable. So you apply it, rub it in a couple times a day. Now sometimes when people take a hot shower, even hours after they've applied the ointment, that area can heat up considerably. So warn them that that's going to happen, and then just sit back and wait for the pain relief over a matter of a few days. Do it on an ongoing basis. It's fantastic for controlling that pain. Remember that this ointment is hot, 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 so you need to be very careful where you apply it when you're using it. None in the eye, no accidental rubbing of the nose, that sort of thing. So we're blocking the pain, not creating heat, and it takes a while to take effect. So it's not good for acute pain, it's good for ongoing chronic pain. A remedy that's so successful, so easy to use, available, well tolerated, economical, a great remedy for people to have in their toolkit for pain. Another well-known ointment, especially in Europe, is St. Johns Wort ointment. St. Johns Wort is not analgesic in and of itself, but it's a tissue healer. So for tissue that's been damaged in the short term that you want to accelerate the healing, we can use St. Johns Wort as an ointment. Now, the idea that St. Johns Wort would become a popular internal remedy for mood was the farthest thing from the minds of herbalists if we go back 20 years. But what we did like St. Johns Wort for was applying to the tissues for sunburn, various kinds of rashes and trauma, an anti-trauma remedy similar to arnica, let's say. So St. Johns Wort oil is extracted from the plant by usually infusing into an oil. That oil is applied directly or made into an ointment and applied to the area of concern, such as an area of sunburn. So it helps the tissue to heal up quickly. So it's a first aid measure for temporary injuries to the nerve, to the tissue from things like the sunburn. Well worth knowing about, a good thing to add to your toolkit, and not yet familiar to very many Americans, although quite popular in Europe. The next remedy to talk about topically is a very popular remedy, Arnica Flower, which almost everyone has heard about. We're talking here about the herbal version of Arnica, not the homeopathic version. So we're going to be using material doses, not highly dilute homeopathic doses. So an herbal tincture of Arnica applied in some manner to the outside of the body. The active constituents in Arnica are cell proliferants and help the cells to heal by enhancing their ability to recover new cells and recover the tissue from the injury. So Arnica externally is used to treat strains, bruises, connective tissue type disorders. So we start with a tincture of Arnica, which can be used just as is as a liniment. That works very, very well, and no need to go beyond that often. But Arnica is sometimes made into various kinds of ointment bases and things, which is perfectly fine. Arnica is seldom available as a topical product in the United States. It's very popular in Europe, but most topical preparations of Arnica that are available in the United States are homeopathic. That's not what we're talking about. We're talking about material dose preparations that are applied. It's not feelable when you apply it. So you can apply that ointment, go to bed overnight, you wake up in the morning, and the wrist that you tweaked playing softball feels much better. So for chronic low back problems, for knees that were injured playing softball, or the old football knee, or the tennis elbow, great remedy to know about applying externally. So just about any kind of traumatic situation, Arnica can work well. Bruises, sprains, strains, wounds, rashes, eczema, black eyes, muscular soreness, fractures, arthritis, bruises, hematomas, goes on.